Welcome to Mindfulness, Mental Health Awareness series. Are you sad? Or do you know someone who feel an intense loneliness and do not know why? Most of us are not able to deal effectively with intense change of emotions, and with learning our loved one has a mental illness. Of course, not every single situation on this list will be exclusively due to a mental illness or disorder. But it is important to know the warning signs to be able to identify when you or a loved one needs some extra help. Recognizing early warning signs and how to cope is very important, to be able to seek help sooner than later. Early intervention can help reduce the severity of an illness, and may even be possible to delay or prevent a major mental illness. Today, in an attempt to lessen the stigma and increase awareness, we will be covering 10 signs of mental illness. Sign number 1, persistent feelings of worry, fear, or sadness. Of course, we all experience these feelings at some point in our lives. It is normal for these feelings to develop in response to certain situations. Life is difficult, especially during the developmental years of teens and young adults. We deal with peer pressure, school, work, hormones, all while trying to figure out who we are as a person. According to APA, American Psychiatric Association, if these feelings do not go away, like feeling very sad, withdrawn, or unmotivated, and not being able to snap out of it for more than 2 weeks, then it might be time to seek professional help. Sign number 2, abrupt mood or behavior changes. Are you happy, and then suddenly you're sad, and then happy again? Or you're just feeling down more days than not? Everyone has different moods, but extreme mood swings or not often enough mood change can be a symptom of mental illness. Easily being irritated, quickly to get annoyed, or anger outbursts can be characterized as aggressive or impulsive behavior. Also be aware of mood changes in the other direction. Feelings of excessive excitement or happiness for most of the day, but has nothing to do with what's going on in your life, can cause huge changes in your behavior and energy, and can be a sign of bipolar disorder. If these moods or behavior changes become overwhelming, or is causing you to hurt yourself or those around you, please seek professional help immediately. Sign number 3, out of control anxiety or depression. Do you often think of the future and worry about things in the future that you cannot control? Anxiety is a feeling of fear, dread, and uneasiness. It might cause you to sweat, feel restless, and tense. It can be a normal reaction to stress. However, intense worry or sudden overwhelming fear for no reason that get in the way of daily activities could be a sign of an anxiety disorder, especially if the worry is constant and interferes all the time. Do you often think of yourself as a failure? Feeling of guilt and unworthiness? Depression includes intense feeling of sadness or irritability, loss of interest in activities once enjoyed, excessive fears or worries, and extreme feelings of guilt are all possible signs of major depressive disorder. According to ADAA, Anxiety and Depression Association of America, if you ever felt this way on most days for at least 6 months, it is important to seek professional help right away. Sign number 4, progressive physical sign of stress. Excessive stress can affect our emotions, our body, and how we behave. Sometimes when we are stressed, we're able to tell right away. But other times, we keep going without recognizing the signs. Of course, these physical signs vary from person to person. However, if we experience excessive stress for a long period of time, the physical effects can get worse. Some notable signs are difficulty of breathing, panic attacks, blurred eyesight or sore eyes, fatigue, muscle aches and headaches, chest pains and high blood pressure, indigestion or heartburn, constipation or diarrhea, dizziness or fainting, excessive sweating, changes to period or menstrual cycle, and existing physical health problems that are just getting worse. Sign number 5, regular isolation or social withdrawal. Do you lose interest in activities you used to enjoy and just want to be alone? Avoiding people and relationships that you normally value may have caused you to feel guilty or ashamed about the disconnection. A sense of missing out, sadness, or loss. Taking time away from others can be beneficial for our mental and physical health. However, regular isolation, loss of initiative or desire to participate in any activity, or withdrawal from friends or social activities previously enjoyed could indicate a mental health illness like depression, bipolar disorder, or psychotic disorder. Sign number 6, feeling disconnected, like delusions or hallucinations. Do you feel disconnected? A vague feeling of being disconnected from yourself or your surroundings? A sense of unreality? Many people experience this at some point in their life. If you're feeling disconnected from your thoughts, feelings, memories, or sense of identity, you might be feeling or experiencing delusions or hallucinations. These strange thoughts of seeing or hearing things that are not there creates urgency while experiencing it and should be taken seriously. Sign number 7, extreme difficulty dealing with daily life. So, how are you doing so far? Is daily life challenges becoming harder and harder to deal with? Unable to deal with daily life due to extreme difficulty in concentrating, learning, or staying still might cause an unusual drop in functioning at school, work, or social activities. Like suddenly quitting playing sports, failing at school, and difficulty performing familiar tasks. Consistently experiencing this longer than usual might be a sign of mental health illness. Generally speaking, we can be very resilient, but when we are having a hard time getting back up, or we are really worn down from having to keep bouncing back, this might be a sign that it's time to seek professional help. Sign number 8, dramatic changes in sleeping or eating habits. When was the last time you had a full good night's sleep? That when you woke up, you feel very rested? According to sleephealth.org, it is estimated that sleep-related problems affect 50 to 70 million Americans. Sleeping too much or too little could indicate depression or a sleeping disorder, while unable to sleep could be a sign of insomnia, anxiety, or substance abuse. Additionally, having recurring nightmares or other sleep disruptions might also be a sign of anxiety or post-traumatic stress. Another dramatic change that we should not ignore is our eating habits. Changes in appetite like not eating or throwing up to lose weight, significant weight loss or weight gain unrelated to dieting, might be a sign of depression or an eating disorder. Sign number 9, alcohol or drug abuse. Abusing alcohol or drugs to deal with something very difficult can cause mental illness. Stimulant drugs such as cocaine can trigger depression, anxiety, and paranoia, while hallucinogenic drugs such as magic mushrooms can make any mental health issues worse. Sadly, studies found that living with mental illness like anxiety, depression, or PTSD, post-traumatic stress disorder, the more likely the person used alcohol or drugs as a form of self-medication. Sign number 10, thoughts of self-harm or suicide. Do you have thoughts of purposely harming yourself or plan of ending your life? Please know that you're not alone and that your life is worth more than you realize. Deliberately hurting your own body is a harmful way to deal with emotional pain, anger, or frustration. In 2020, according to AFSP, American Foundation for Suicide Prevention, there were an estimated 1.20 million suicide attempts. On average, there are 130 suicides per day. It was also stated that over 50% of all people who die by suicide suffer from major depression. If one includes alcoholics who are depressed, this rises to over 75%. An estimated 14.3% of deaths worldwide, or approximately 8 million deaths each year, are also attributed to mental health disorders. These are very depressing facts. Please, if you ever have thoughts of self-harm or suicide, please seek help immediately. The best way to prevent suicide is through early detection, diagnosis, and treatment. Lastly, if you're experiencing one or two of these signs or symptoms, it does not exactly mean a mental illness. However, it might indicate a need for further evaluation, especially if you're experiencing several at one time and the symptoms are causing serious problems. Thank you so much for watching. To support our channel, give the video a thumbs up, comment below, and share with your friends. For more video like this, subscribe, check out our other videos, and as always, take care of yourself.